Okay. 5 people. Please take the phone start. Okay. My topic is substance abuse. Again. My sister is a an addict. That's why this is so prevalent to me, interests me. She has been for about 15 years, in and out of jail, in and out of rehab. It amazes me that they're unable to stop. It's something in their brain that they can't, it's truly a disease, not just that they want to use it. So, so in 2005, 22 million Americans struggle with drug or alcohol problems. 2005 is a long time ago, so I'm sure it's higher now. It's very prevalent in today's society. I'm pretty sure everybody knows somebody who has struggled with drug or alcohol, or knows somebody in their family that struggled. Commonly abused substances include CNS stimulants, CNS depressants, alcohol, and marijuana. Some effects on the human body from CNS stimulants. So CNS stimulants are a group of pharmacological agents, which means they're medications that are capable of exciting the whole central nervous system. This is accomplished by increasing the activity of neurotransmitters that are involved with behavior stimulation. Some CNS stimulants include amphetamines, Ritalin, ecstasy, cocaine, and caffeine. CNS stimulants effects on the body include tremors, restlessness, anorexia, insomnia, agitation, increased blood pressure and heart rate. It relaxes the bronchial smooth muscles in your lungs, constipation and difficulty urinating, sexual dysfunction in men, increased libido in women. It said in this article that women made them feel sexier when they were on stimulants. CNS depressants induce a general depressed feeling. It depresses any body system that uses energy. Some depressants include Valium, Klonopin, Librium, Xanax, and Ativan. All prescription, all used very frequently, but you can misuse prescriptions. Some effects of depressants on the body include hypotension, decreased cardiac output, direct impairment of myocardial contractility. Overall, it depresses your respiratory system, decreases your body temperature, and men have an inability to maintain an erection. Alcohol, some effects on the human body. It's a general, non-selective, reversible depression of the central nervous system. Overuse can cause peripheral neuropathy, which is pain and burning in your extremities. Alcohol myopathy, which is sudden onset of muscle pain, swelling, and weakness. Your esophagus and stomach becomes inflamed. Nausea and vomiting occurs. Your stomach wall is eroded. Pancreatitis is linked to alcoholism. Alcoholic hepatitis, and of course cirrhosis. Marijuana is the most commonly used illegal drug. 75.7% of illegal drug users use marijuana. Some effects that it has on the human body include tachycardia, orthostatic hypotension, obstructive airway disorders such as COPD. Long-term use can lead to laryngitis, bronchitis, cough, and hoarseness. Decreased sperm count in men, suppressed ovulation, and disruption of menstrual cycles in women. And it causes feelings of euphoria, disorientation, and relaxation. So now some effects on the human brain. CNS stimulants that enhance the effect of dopamine and norepinephrine. Misuse of CNS stimulants can lead to feelings of hostility, paranoia, and psychosis. Patients going through withdrawal can experience headaches, anxiety, depression, and irritability. CNS depressants effects on the human brain. It slows your brain's activity, produces drowsy or calming effects. They're very useful in treating anxiety and sleep disorders. And patients going through withdrawal can experience inappropriate sexual or aggressive behavior, mood liability, and impaired judgment. Alcohol effects on the human brain includes feeling of relaxation, loss of inhibition, and drowsiness in low doses. Wernicke's encephalopathy is a thiamine deficiency, and it causes paralysis of your ocular muscles, double vision, and stupor. If thiamine is not replaced, the patient will die. Patients that are recovering from Wernicke's encephalopathy can have Korsakoff psychosis, and this includes confusion, loss of recent memory, and the patient does something called confabulation, which is where they make up memories. for the areas that they can't remember. Patients going through alcohol withdrawal will experience anxiety, depressed mood, irritability, hallucinations, and insomnia. So marijuana effects on the human brain, euphoria, anxiety, sensation of slow time, and impaired judgment. Heavy long-term use can lead to something called amotivational syndrome, which is where the patient is completely preoccupied with using the substance. Nothing else matters to them. They're lethargic. They have lack of motivation. So substance abuse and mental illness. 53% of patients who have drug abuse problems also have mental health illness. 37% of patients who have alcohol problem also have mental health illness. Most commonly, mental health diagnoses seen with drug abuse is antisocial personality, schizophrenia, bipolar. So treatment for these patients, it's important to treat both the substance abuse and the mental health illness so they can have a full recovery. Patients with coexisting substance and mental health illnesses are designated to special groups that treat both. Dual diagnosis programs take a more supportive approach as opposed to confrontational approach that substance abuse groups have. There is peer support groups. Group members can offer encouragement to each other and give each other advice because they've been through it. They live not the same life, but the same situations. Psychodynamic therapy is where the patient discusses personal history of how their psychiatric disorders and substance abuse reinforce each other, and then how to break that cycle. And then cognitive and behavioral therapies train the clients to monitor their mood and thought patterns that lead to the substance abuse and how to cope with cravings and relapse. There is 12-step recovery programs. Alcoholics Anonymous, it's for alcohol use. Everyone's heard of that. Narcotics Anonymous is for patients that abuse medications and other drugs. Some patients with dual diagnoses, if their mental health illness is more prevalent than the drug abuse, they do better in psychiatric groups. And the group topics are directed towards areas that are unique to patients with both substance abuse and mental health issues, such as mixing medications with other substances and how this affects the body. And then, of course, all patients must go through detox. It's important to rid the patient's body of all substances. They frequently go through detox at rehab facilities. Detox can be very dangerous depending on what they're coming off of. So they need medications to help them get through the symptoms. And then there's sober living facilities for them to go to afterwards, participate in, so they have long-term recovery.